Welcome to this second season of Altea Talks, the dedicated podcast being brought to you by Altea, the unique provider of combined insurance and risk management solutions designed exclusively for the medical, allied health and care sectors. I'm your host, Will Marshall, and I'll again be joined in this second series by some of the leading figures from across the sectors. My guests are going to include practitioners and professionals, regulators, clinical risk and governance specialists, and an array of legal experts who are going to help us get to the heart of the hottest topics affecting health and social care sectors today. So, if you're looking for frontline knowledge and expertise, if you want valued insights into these most dynamic, challenging, and rewarding of sectors, then look no further because you're in the right place. Welcome again to Altea Talks. Hello and welcome to this final episode of Season 2 of Altea Talks. I'm delighted this week to be joined by Brooklyn Bond. Brooklyn is a tattoo artist and PhD student at the Technological University of the Shannon in Limerick, Ireland. Her research explores the history of tattooing, how bias toward tattoos has developed, and how it appears in modern society. Her previous publications examine the presence and impacts of tattoo bias in Ireland's hospitality and tourism industries. Brooklyn previously worked in the beauty and wellness industry, so her current interests lie in combining her industry knowledge with her bias research. Specifically, Brooklyn writes extensively on how beauty practitioners can reduce bias towards clients during the consultation and treatment process to deliver client-led service and care. Brooklyn, a very warm welcome to Altea Talks.
Thank you so much for having me.
It's a pleasure. In today's episode, we're going to focus on what we actually mean by bias in the context of beauty and aesthetics. And I would like to start, Brooklyn, if I may, by just asking a sort of general overview question of what do we actually mean by bias in that context, and why does it show up even in well-intentioned practitioners?
Yeah, so bias, just to give you an overview, bias is a cognitive shortcut that we have in our brains. Everyone has them in different forms. They're not intentional most of the time, and we kind of develop them pretty early in life through our household, our family, our friends, our school life, but we do develop them throughout our adult life as well. When it comes to bias, it can be implicit, so it can be subconscious. You're not aware that you have these biases. They're just kind of snap judgments you're making without intention, or they can be explicit, so you're aware that you have this bias. But when it comes to beauty and wellness and aesthetics, the way it manifests would be, for example, in a consultation, you're assuming things about a client without them actually asking or telling you this information about them. So just to give a quick example, if someone has a piercing, you're going to assume perhaps that they have a high pain threshold, and then you may not give them the same level of care that you would give to someone without piercings. So that's just an example of what it means. The reason it's so relevant is because when it comes to our clients, they trust the practitioners so much. They trust us with their bodies, their body image. They trust us with their medical information sometimes. They trust us with, painful procedures. So they have to have trust in you that you're not going to make judgments without their best interests at heart. So that's why kind of general theme for all of my discussions and all my research around bias in the beauty sector is all about having a client-led approach, leading with what the client wants, with their goals, without making assumptions about the goals yourself.
Yeah, and that fits very well, doesn't it, with other aspects of treatment and care, where having a client-led approach, and I would thought particularly important in beauty and aesthetics.
Yeah.
And why is bias? I think you may have answered this, but why is it such a hugely important topic in that field, especially?
Well, It's important right now for a few reasons, because the beauty industry is expanding so exponentially every single day. So even treatments are getting more complex, they're getting more scientific and technical. So there's a greater risk involved. So your clients, one, need to trust you enough to give you the correct information during a consultation. But two, you also need to be asking the right questions. You can't be assuming things about someone's diet, about someone's lifestyle, about someone's preferences, especially in these high-risk procedures. But of course, even down to things like makeup and nails, you still shouldn't make those assumptions. But that's one of the reasons why it's so important. But also there's a more diversified society, especially in Ireland and the UK now. So your clients are going to be more diverse. And then thirdly, we have kind of the increased importance of EDI in the last few years. So that's another aspect of it as well. You could talk about it for hours, really, but those are the three main reasons why I think it's particularly important.
Yeah, thank you. And to what extent do cultural norms in the UK and Ireland, the media, general sort of depictions of beauty standards, to what extent do those sorts of things contribute to unconscious bias in treatment decisions?
Yeah. So we obviously still have a pretty Eurocentric beauty norm in Ireland and the UK, probably all over kind of the Western world in general. So what this does is, and particularly with appearance-based biases, which we'll be talking about in a minute, a lot of bias surrounding Eurocentric beauty standards means that clients that are stereotypically more beautiful or thinner or younger or able-bodied, they're treated better in society in general. And that then extends to beauty practitioners and aesthetics practitioners, treating them with a more level of care, treating them more attentively, which obviously most people don't do that on purpose. It's not intentional. Like I said in the beginning, these are cognitive shortcuts that our brains have developed throughout thousands of years. So it's just about reducing kind of the actual consequences of them.
It's being self-aware. And,
Yeah.
And I mean, what are some of the early warning signs that bias might be influencing a beauty professional's interpretation of a client's needs or their expectations or their suitability for a particular treatment?
Well, the first one that I would think of is if you're shocked by a client's goals. If your client tells you that they want a particular treatment or they want a particular result from the treatment and you are surprised by that, that's you in your mind assuming that they wanted something else based on what they look like or based on information that they gave you about their lifestyle or their religion or their personality type. Another one would be that obviously your clients are not trusting you with their information or that they're not fully trusting you with the treatment. I'm sure there's loads more. But
That's interesting, isn't it? Can we just sort of look at a couple of specific areas?
Of course.
And if we could start with appearance-based bias and weight bias, and maybe sort of kick off that topic by asking you how common appearance-based bias is in the beauty sector and what forms it can take in everyday practice.
Yeah. So this is actually my area of research outside of this, is appearance-based bias. So it influences literally everything we do on a day-to-day basis. It influences how you speak to people, how attentively you listen to people. You make a judgment based on what someone looks like within the first 5 seconds of meeting them. That's how our brains work. And whether they align with your standards of beauty is a huge part of the bias conversation in general. So that then applies to beauty practitioners and how they interact and treat with their clients. When it comes to appearance-based bias, we're talking about things like hair color, hairstyle, whether they've tattoos or piercings, how they do their makeup, how tall they are, what body size, what body shape they are. So some examples would be someone a plus-size person, and you're giving them a facial, assuming they have a poor diet or don't exercise well, or assuming that they want a slimming treatment. These are examples of how weight bias manifests. And then for appearance-based bias, if you're doing someone's makeup and they have acne, assuming that they want the acne covered up, or assuming someone with fine lines wants the fine lines reduced. Again, all coming back to client-led, you should never make assumptions. And it's very easy to do, especially if you're under pressure or you're a bit not very confident with the treatment procedures. It's very easy to make those snap judgments. But if you practice and you do your reflective practices, just ensuring that you're always asking what the client wants first.
Yeah. I was going to ask you about that, actually. You know, what practitioners might be able to do to break the link between personal beauty ideals and the treatment recommendations that they're giving to clients. And given that it's so ingrained, this bias, from what you're saying, it's something which presumably has to be a sort of conscious process.
Yeah, it's not something that you can get rid of. You can never, ever get rid of biases. You can only reduce kind of the manifestations and how they are actioned. So something that I always do with my clients is I will kind of, if there was ever a tricky consultation or the results weren't what they wanted, I'll always do I have a little journal and I always do a little reflective practice. And I'll ask myself different questions like, you know, what went wrong here? What judgments did I make? What questions did I not ask this client that I would usually ask other clients? But another thing to do is to, if you're a employer, is to, you know, open up that conversation with your staff. Don't bring any kind of negative connotations around it. You know, be open and honest. Don't make people afraid to ask questions. And when it comes to things like representation, like, give those staff your training. Give the staff the training that they need when it comes to diverse ranges of skin tone, hair textures, hair type, different skin types. Because if the practitioners aren't confident, they're going to not be able to perform the treatment in the right way, and they're not going to know what questions to ask beforehand.
Yeah, sure. And I guess on a personal level, it's about having strategies to help ensure that the practitioners are sensitive and respectful, non-judgmental, and that they communicate.
Yeah, exactly.
Yeah. It's quite interesting, actually, the way the sort of comparisons between what you're saying about bias and just the sort of general direction of travel for health and care anyway.
Exactly,
about making it more patient-centric, making it more about what is important to the patient sitting in front of you.
Exactly.
It's interesting. Can I just move it on and ask about gender and LGBT plus and neurodiversity bias, and ask you first, what forms of unconscious bias might practitioners hold toward LGBT plus clients, and how do these biases impact on the important thing you've been talking about of client trust?
Yeah. So when it comes to gender and sexuality bias, we'll start with gender bias. So this is obviously bias based on someone's gender. This in particular manifests towards men when it comes to, say, for example, the beauty and spa industry. So this could be, if you're a practitioner, this could be saying things like, men don't usually get this treatment. Would you like something else? Or if you're performing a manicure, for example, assuming that they just want clear polish, they don't want any designs or anything. But it's not just the practitioners that I see this a lot with. I see this a lot with admin and reception staff as well. An example of sexuality bias would be if someone's, say, for example, you have a man coming in buying a voucher, assuming it's for his girlfriend, being like, oh, is this for the missus? Do you know? And these are things that we say casually without any bad intentions at all. But it's just being aware that, you know, these little things do impact the client's trust, and it can be quite jarring for them as well. Another example would be if you have a male client coming up to the desk saying, can I book in a facial? A lot of salons make the mistake of just having men's facial as an option, and you would never have woman's facial down as a service option. And I know that men have different skin types and, you know, there is slight differences, but the clients results should be more important than their gender. So through client-led approach, of course, and through consultation, figuring those things out without just lumping them all in the one. And then when it comes to neurodiversity bias, this is bias towards people with neurodivergencies, for example, autism, ADHD, Asperger's. When this is most prominent for me, what I've seen most is when it comes to treatments in private rooms. So, for example, massage and facial. In these private rooms, there's usually music playing, there's usually lighting that can be adjusted, and there's usually some kind of fragrance. So there's usually essential oils burning. These three sensory aspects can be very overwhelming to some people, but it can obviously it differs based on the individual, of course. So what I love to see when I'm kind of reviewing consultations is I love to see when they ask the client, what's your preference for music? Do you want the music kind of turned down a bit, or do you like it a bit louder? What is your preference for fragrance? Would you like no fragrance, or would you like a particular oil? And then for the lighting, do you want it bright? Do you want low lighting? Just asking the client what they would prefer to make the situation more comfortable for them. Another example of neurodiversity bias is assuming someone doesn't have the patience to sit still for a certain length of time and rushing through the treatment. Another important example would be assuming someone's not paying attention to you because they're distracted or they're not taking in the information that you're giving them, particularly in the consultation or in the aftercare instructions. So what's important here is that you're giving people very clear instructions, maybe even having a written handout or a copy that they can get emailed. My aftercare instructions and the consultation printout is always emailed after the appointment, but I do always offer a physical handout as well. So those are just a few examples.
Yeah, so those are some of the sort of common misassumptions. Yeah. And it's interesting the way it goes from what you're saying to not just to the sort of sensory environment, but the actual appointment structure.
Yeah.
And the sort of almost like the admin side of it.
Exactly, yeah.
And I mean, are there any common misassumptions about treatment preferences or pain thresholds or expectations of LGBT plus or neurodivergent clients that really need challenging in your view?
Yeah, so this is just from my own experience, is that it was always assumed that when it comes to gender, it was always assumed that male clients want an almost undetectable result. They don't want people knowing that they've had their eyebrows threaded, or they don't want people knowing they've had a manicure, but that's not the case for all men. Obviously, everyone is different. So just having the kind of self-awareness to treat those clients the same way you would treat your women clients. When it comes to LGBT clients, I see it a lot in makeup. People assume that, for example, if you have a queer man getting makeup done, that they want drama and they want colour. Obviously, some do, but it's important to just ask them what their results are. And then when it comes to neurodivergent clients, they are getting the treatment done for the same reasons neurotypical people are, whether it's a particular result or it's relaxation. So they don't want to feel rushed. They want to feel listened to and acknowledged, and they want to feel cared for the same way you treat your other clients. So assuming that they want to skip the massage because you feel like they're not going to be able to sit still for it, for example. Those are all assumptions that we make without asking the client first. So if you're in that situation, for example, just ask them, this foot massage part of the pedicure is optional. Do you want to go ahead with it? They'll tell you yes or no. And it's very simple questions like that make the difference for the client and make them feel acknowledged and listened to.
Yeah. Thank you. And I mean, do you see this kind of well, I mean, I'd say sort of common sense approach, but these kinds of initiatives, are they ever included in a policy or
very rarely?
Yeah.
And that's what my research is kind of aiming towards, is this kind of EDI consultancy where consultations and treatment etiquette towards clients, but also towards staff, because that's a whole other conversation as well as bias towards the staff members as well. So that's where my research is looking towards, is to improving the policies, improving the treatment structures, improving the environments, and improving the education for staff as well. Because it's very easy for me to say, oh, do these steps, but if they're not encouraged in the workplace regularly, then they're not going to work if you just do it once or twice and you're doing it in isolation as well, because obviously your biases are influenced by the people you work with. So if everyone is on the same page and everyone has the same level of training, then it's going to be a lot easier for the biases to reduce.
Yes, thank you. Can I just move it on to have a look at another type of bias, racial and religious biases? And I'll start off by asking you, how does racial bias, whether it's conscious or unconscious, affect the assessment, treatment planning, or the interpretation of skin conditions or so forth in aesthetics?
So when it comes to racial bias, a lot of it is down to lack of training and lack of knowledge. So obviously this isn't any particular therapist's or practitioner's fault, but it is important that we don't just take the information that we're learning in our courses and leaving it at that. We do need to go a step further, because a lot of these training courses don't include people of color or different hair textures or hair types. So it is important that as an employee and or employer that you are getting that training. So this would manifest, for example, I work in tattooing, and just an example is that there's this myth that dark skin doesn't hold color well, which is just factually not true. It's just a different technique, first of all, and also you have to have knowledge of your color theory, because the same ink color is not going to look the same on all skin types. So it's down to a lot of the time lack of knowledge, and you see it a lot in hairdressing when it comes to different hair textures. But of course, you can't be an expert in everything. The real kind of result here is that if you're not knowledgeable enough to perform the treatment, to one, be honest with the client, not make them feel like their skin is a problem or their hair is a problem, and also have people in mind that you can recommend them. Don't just leave them walk out the door with nothing. Give them guidance to where to go, and then take that kind of experience and hopefully train yourself further. You see it a lot in makeup where therapists just don't have the right foundation range. That's a very simple step to take, is to just expand the range of colours you have in your makeup kit. So it is a lot of the time down to more technical changes like that you can make.
And really sort of taking the time to educate yourself about
exactly.
Different skin types and hair types and things like that. Yeah. Sure. Can I just ask about religious bias and in what ways religious practices such as modesty requirements, hair covering, fasting, things like that, in what ways they can influence treatment planning and aftercare?
Yes, of course. The first thing that comes to mind for me when it comes to religious bias, and particularly, like you said, modesty, is in settings like massage, where the clients need to undress, or even waxing or spray tanning, where the clients need to undress. People can often kind of tiptoe around this. The client knows that they're going to have to undress if they're getting a spray tan. It's just about making them feel comfortable around you. So instead of saying, okay, you can whip off your clothes there, say, I'm just going to step out of the room. Here's a robe. I'll give you a few minutes. I'll knock to make sure that you're ready for me to come in. So it's just kind of like you said a minute ago, these little common sense details that will make the client feel more comfortable, rather than just, assuming that they're comfortable straight off the bat. You need to kind of have a certain level of care with clients.
Yes, thank you. And what sort of steps can clinics take to ensure that their marketing, their branding, their imagery, and their environment reflect racial and religious inclusivity rather than a more narrow beauty ideal?
Well, the first thing for marketing is obviously to have a more diverse range of models and examples in your social media and your marketing, but also having more kind of logistical, like, things like privacy screens if needed. In tattooing, the industry I'm in right now, privacy screens, people don't just use them if they're getting intimate places tattooed. Some people want them for modesty reasons as well. So small things like that, you don't need to overthink things sometimes. Small changes like that are huge for clients.
Yeah, thank you. I'd like to move it on to talk about disability and age and class bias.
Mm-hmm.
Start off by asking, what are some of the more common assumptions that practitioners might hold about disabled clients' aesthetic goals, and particularly around their autonomy or their ability to consent to treatment and those sorts of issues?
Yeah. So here it's similar to neurodiversity bias, where these clients are getting treatments for the exact same reasons we are. They're getting it to achieve a particular result, or they might be getting it for relaxation. They might be treating themselves. They might be celebrating something. They might have an event to go to. It's important that we acknowledge that, one, they're perfectly capable of having a good time like we are. They're perfectly capable of coming along and getting their nails done. And to not treat them like children, which is a lot of the time, unfortunately, what we see, and treating them like they're capable of having bodily autonomy. One thing that, we see a lot is access to kind of upper levels of the salon. And obviously, sometimes the rooms are not, they're not wheelchair accessible. And like I said, with racial bias, it's important that you don't just, allow them to leave with feeling lost. Tell them there's a salon down the road here that's on a ground level or that has an elevator. Give them guidance to where to go. When it comes to age bias, this is got to do with someone being too young or too old for a particular treatment or a particular result. For example, you might assume that older client wants an anti-wrinkle treatment or they want a firming treatment without asking them. And this is all kind of linking to appearance-based bias, where we see these different attributes as imperfections, or we see them as something that someone wants to hide or cover. This is not the case for everyone. If a client says to you, I would like to reduce my wrinkles, then work away. But until they actually say those words, it's important that you, again, with the client-led approach, ask them what their goals are, because they might not want to reduce their fine lines at all. They might be perfectly fine with their fine lines. They might want a completely different result. Yeah, and then we have class bias, which is related to someone's socioeconomic status, assuming this is more got to do with things like budgets and payment plans, not recommending particular treatments to someone because you're assuming they can't afford it, or taking advantage of someone who you feel can afford it and, kind of upselling them just because you feel like you can.
So what adjustments can help practices become more inclusive across disability, age, and an income level bias?
Well, from kind of a logistical point of view, obviously a lot of beauty practitioners themselves don't have the power to do these things, but from a salon owner perspective, making small adjustments to make your salon or your space more accessible to disabled clients, even things like the doors being wider, the rooms being laid out differently, lighting levels being able to be adjusted, privacy screens if needed. And then when it comes to class and age bias, it would be fantastic to have things like payment plans if needed, but obviously that's not always an option. A lot of these are got to do with management and an owner, more logistical changes to make. And then if you're a practitioner yourself, it's again with the reflective practice. If you want to reduce your bias towards older clients or towards disabled clients, it's all about recognizing that you have these biases, because everyone has them, they're ingrained, not shaming yourself for them, and then reviewing your own interactions with all of your different clients and making sure that you're treating everyone the same and treating everyone with that dignity and care.
Yeah, thank you. And I think sort of drawing it together, how can leaders or clinic owners foster a team culture where staff feel safe to challenge each other's assumptions constructively?
Yeah. One, I think training is really important. It's really difficult if you're not an expert in the field to start those conversations. So training is an incredibly important one, having EDI training amongst your staff. Having regular meetings with your staff, doing it once is probably not going to make a huge difference. You need to be constantly having those conversations, reducing the kind of shame around it as well. But from a more kind of logistical perspective, bias really does thrive on fatigue. So when you have a busy salon situation, you have a kind of hectic environment, those biases are going to come forward a lot more because your staff aren't thinking clearly. They're trying to keep to a certain timeline. And especially around now, around Christmas time, you'll see it a lot more as well. So from a more logistical perspective, giving your staff adequate breaks, giving them adequate overflow times in between appointments will give them the opportunity to take a breather and decompress and treat their clients with the same consultation, because the consultation is where the bias can either be exaggerated or can be reduced, and then giving them adequate time throughout the treatment to give every client the same level of care that they need.
That's very helpful, good practical advice about the reflective practices that practitioners can build into their routines and processes to help them to address and spot patterns of bias in their decision making. What about sort of more wider resilience strategies to help practitioners stay open-minded and compassionate and self-aware in what you've just described? It's such a fast-paced and busy and appearance-driven industry.
Exactly.
What would you say about that?
I think just broadening your lens. A lot of practitioners, once they finish their training, they don't really prioritize expanding that throughout their career. And obviously, as time goes on, the industry is changing, society is changing. So it's important to, one, keep your training up to date because the requirements are always changing all the time. And then those different requirements will change your consultation and then will change your interaction with the clients, especially when it comes to the kind of higher technical treatments, especially when it comes to laser and everything. We have the different, Fitzpatrick scales with that. And, just an example of a way you can update your training to reduce the manifestations of your bias. So that's just one example, update your training, but also expanding your lens in general when it comes to society and, giving yourself that time to educate yourself. If you're someone that, for example, wouldn't have a lot of queer clients, broadening your lens to maybe aim to include them more as clients. It'll just do you the world of wonder when it comes to reducing your biases, because if you're around people more and you diversify your client range, then those biases will slowly reduce naturally.
Yeah, thank you. I'd just like to finish up really by asking you generally how you see the beauty and aesthetics industry evolving to manage bias and to address these issues that you've so eloquently talked about today going forwards. Do you see an improving picture, or are you glass half full or glass half empty on that?
In my research looks at bias in general, and it is, of course, improving as time goes on. But especially when it comes to the workforce industry, like, for example, Ireland has reached full employment finally. So you want to keep your staff, you want to keep your clients, because that's what's going to keep you afloat. So it's important, if you're an employer or you're a salon owner, that your clients have trust in you and that they keep coming back. And one key way to do that is to make them feel understood and listened to by your staff members, because a lot of the people that we've talked about today, disabled people, people of color, queer clients, they don't feel listened to a lot of the time in other aspects of their life and other aspects of society. So these people finding your space and feeling comfortable and safe and listened to in the space is incredibly important.
Yeah, thank you. And thank you again for coming on the podcast today.
Thank you so much.
Speak. So it's such a fascinating area, and I wish you best of luck with your research.
Thank you so much.
And look forward to reading more about it in due course.
Thank you so
thanks
much.
for joining us.
No problem.
Thank you for tuning in. I hope you enjoyed today's episode of Altair Talks. If you did, please don't forget to subscribe or leave a like or a review on whatever platform you're listening on, as this helps spread the word. If you have any questions or comments or topics you'd like us to explore in future episodes, please do contact us, as we'd love to hear from you. You can find us on LinkedIn or visit our website at www.altairinsurance.com. Stay tuned for more episodes, and until next time, take care of yourselves. The information contained in this podcast is not intended to represent a complete analysis of the topics presented and is provided for information purposes only for practitioners in the UK. It is not intended as legal advice, and no responsibility can be accepted by Altair or by Brooklyn Bond for any reliance placed upon it. Independent legal advice should always be obtained before applying any information to particular circumstances.